Hi, good morning. My name is Dr. Amy Delgado, and I am excited to be with you this morning and able to share an update on the African swine fever situation in Hispaniola. So as many of you know, African swine fever was detected in Hispaniola in 2021 in swine samples, but what you may not know is that we do have a bit of a history of this disease in the Western Hemisphere. So I put together just a little bit of information to provide some context about how this disease has behaved in the past and the efforts that it took to get rid of it originally. So the last time we had this disease was in July of 1978 when it was confirmed in some swine samples from Dominican Republic, followed in January of 1979 with samples from Haiti. The disease was fairly widespread at the time of detection, not surprisingly, and the response initially was a little bit disorganized. I think they really struggled to get things implemented. They were focused very much on depopulation around infected premises and in kind of the surrounding areas, but they couldn't get ahead of the disease. And so the Dominican Republic, after about a year of going through that experience, decided to formalize their eradication program and move forward with a whole island depopulation approach. So that pilot began in Samaná and then was eventually expanded to the entire Dominican Republic. They completed the slaughter of all swine by 1980. So their last case was actually in August of 1980. Because the island of Hispaniola is so integrated, they weren't able to declare disease freedom until Haiti had also brought the disease under control. The Haitian program took even longer to get coordinated for, again, a variety of reasons. Following that introduction in 1979, the disease impacts really peaked in 1980, but the response to the disease was really slow, and so it took them even longer to adopt a whole island depopulation strategy by 1983. So at that time, they set up a formal program. It was coordinated through an international coordinating committee with a variety of organizations involved and funded through international funding sources. It took them 2 years to complete that whole island depopulation, but they did get through it. It was an expensive process. Certainly at the time, you can imagine the DR side cost about $15 million, Haiti $24 million. And in both of those cases, well over 1 million animals had to be sacrificed. And there was a lot of trauma within communities with producers and those who were involved in raising swine. At the time, the military was very involved in this program, and so there were a lot of scars left behind by taking this approach. But it was very successful in that they were able to eradicate the disease. They brought in some specific pathogen-free pigs, used sentinels, identified, that there was no virus remaining, and they were able to eventually restock. So in that context, that historical background is when the disease was reintroduced and discovered in 2021. And so it certainly led to a lot of similar conversations, similar struggles and challenges in controlling this disease. So following that detection in 2021, APHIS was really on the ground from the beginning. We had been in partnership with them, looking at shoring up diagnostics and laboratory things well before the outbreak occurred. And so once the disease had been identified, we rapidly provided personnel to support things like just technical support, expertise, diagnostics, and staffing support for their laboratory training, and then also working to collaborate with other international organizations under the Global Framework for Transboundary Animal Diseases. If you look at this picture, this is a very typical small swine production unit. This was located up in the north part of the country where one of the first cases were identified. And as you can tell, that this is a space where biosecurity is extremely challenging. It's very difficult to clean and disinfect, and so they're using really, really long fallow periods at this point in time. They haven't allowed these farms to restock even well after a year of having the disease. And there's been kind of varying approaches to backyard type swine producers just because of the concerns around this disease itself. So after about a year of working in the Dominican Republic, we began to really assess where we were at, and we knew that the progress had been slow. surveillance and control activities by the Dominican Republic have been somewhat limited, and there were a lot of political complexities to the response. So based on those outcomes, we ended up deciding late last year to pivot and refocus, looking at establishing structures and processes to support a program that will be in place for a while to ensure progress. So we don't have a change in our goals or objectives, and we're going to continue to focus on ensuring that the virus does not spread to other countries. So if we look at kind of how this disease has behaved, this is the map of official reported cases to the World Organization for Animal Health. These cases were all reported within the first 9 months for Haiti or within the first year of the outbreak in the case of the Dominican Republic. And you can see that even in that short amount of time, this disease had basically spread to everywhere. And those areas that don't have cases is probably because they just hadn't gone and looked. Most of the reporting on the Dominican Republic side was through passive reporting of sick pigs and dying pigs. In Haiti, they were actually sending out teams to sample and collect small batches of samples from all these different areas to try and understand where the disease was. But it spread very, very quickly to all parts of the island. If we look at something a little more current, this is a publication that came out just late last year and included this map looking at the number of confirmed outbreaks. Interestingly, if you were to overlay a map of swine density in the Dominican Republic, it would look very similar in terms of colors. And so you see they continue to have some pretty hot areas of disease spread and high numbers of caseloads in areas with high densities of pigs. The outbreak is still ongoing. They are still experiencing a number of cases every week. And still certainly experiencing a lot of production losses. So when we look at some of those production impacts, we have seen that they have been severe. So in 2021, when we first started talking to them about their compensation program and what they were looking at, they thought they may have lost up to about 50% of their swine herd at that time. By 2022, production was down 28%. Year over year compared to 2022, with an additional 9% decline projected in this year, 2023. They went from being 61% self-sufficient in producing pork down to 32% by 2022. So just really severe impacts. And while we have been able to export a lot of U.S. pork to the Dominican Republic, it's certainly a concerning reminder of what this disease can do to a country and a production system. So in terms of APHIS activities and what's happening, we've been focused in these key 7 areas. So biocontainment, meaning keeping this virus on the island, laboratory diagnostics, capacity, training, tools, everything that they need to have a high-functioning, high-throughput laboratory, surveillance design and implementation, getting them to move past passive reporting into active surveillance and targeting risk, a risk-based approach to surveillance. Incident command, having clear lines of command and communication, biosecurity, really trying to stop disease spread between farms, which, as you can see, even from this picture, which is a sow unit there in the Dominican Republic, biosecurity remains a huge challenge. Movement controls, again, another area that is really, really difficult. They have some movement controls and kind of normal working hours, but everybody kind of goes home at a certain time of day, and it becomes really hard to prevent animals moving. And then compensation. We've been working with them to shore up their indemnity program, make sure that producers are compensated for early reporting and participation in disease response and control. Lots of work still left to do in the Dominican Republic. The situation, unfortunately, in Haiti is even worse. So this is just a picture of some typical backyard pigs in Haiti. You can see the conditions that they live under and what they look like even when they don't have African swine fever. So you can imagine it's a really tough place. As many of you know, the situation in Haiti right now politically is very complex. ASF is not their top priority. And the country is facing a myriad of other issues. The U.S. government is engaged with Haiti on a number of fronts with what they're facing. I will say it's very difficult to move around the country due to the lack of security. Many parts of the country are run by gangs, and so even the Haitian officials are not able to move around and go out and sample pigs or deal with pigs that are dying. It really is a difficult situation. We continue to provide sampling supplies and testing support for Haiti. Those samples are shipped to FAD, and we test them and get the results back to them when they are able to get some pigs sampled. We've also worked with them on some biocontainment activities, trying to invest in port incinerators for ports and airports, and shore up some of those places just to make sure that this virus doesn't leave the island. But again, it is a very challenging space to work, even in that regard. APHIS has funded USAID with $3.7 million. They subcontracted that with the Food and Agriculture Organization, or FAO, to work on a couple of different areas. So initial support for the disease control in Haiti, risk communication and community engagement, alternative livelihood support, and then strategic coordination in the DR, Haiti, and the surrounding Caribbean region. We continue to communicate with Haiti in an attempt to make some meaningful inroads, but the situation is really, really difficult. And I do think we are going to be fighting with this disease there for quite some time to come. So with that, I'm going to wrap up and say thank you very much for the opportunity to share this with you, and I'm looking forward to visiting more during our panel discussion today.